Okay, this is our spinal cord anatomy video. So we have our pons, medulla, and then we have our cervical enlargement, and then our lumbosacral enlargement out here, and then down to the conus medullaris, filum terminale, and then we have some of the cauda equina down here. We have different plexuses down the entire spinal cord. So we have the cervical plexus, which is C1 to C5, and then the brachial plexus, which is C5 through T1, and then we have the lumbar plexus, which is L1 through L4, and the sacral plexus, which is L4 through S4. And that will kind of detail some of the inner anatomy of the spinal cord. So first we'll draw out kind of some of the layers here. I'll label them in just a second here. First we have the pia mater, which is not really separated from the spinal cord itself. It's closely adhered. This is the pia mater, and then we have the subarachnoid space, because we have the arachnoid mater here, and then we have the subdural space here and the dura mater here. And we have the denticulate ligaments, which suspend the spinal cord and kind of keep it in place and anchor it between the pia mater and the dura mater. Okay. Next thing we'll draw is kind of like the inner workings of the spinal cord itself. So we'll start with the a rough drawing here. Okay, and then we have so we'll start with the, we have our white matter and our gray matter. This is our gray commissure, and we have our anterior white commissure. So this is the anterior ventral side, and that's the posterior side. We have the central canal here within the gray commissure. We have the, kind of actually drawing some different horns here, but we have the posterior horn, ventral, lateral horn, and then the anterior horn or ventral horn of the gray horns, and then we have the different white columns. So we have the anterior, lateral, and posterior white columns, and then the white commissure right down here, the anterior white commissure. And then we'll just kind of draw some of our, going off of that, we have the dorsal rootlets, which kind of go into our dorsal root, and then our ventral rootlets into our ventral root. We have a dorsal root. We have a dorsal root ganglion here, just because it's kind of fun over here, or this like enlargement, and they join to make the spinal nerve. Let's kind of switch over here, and then so the spinal nerve, we have the ventral ramus, and then we have the dorsal ramus, which is this. This is the ventral ramus. Off of the ventral ramus, we have the gray ramus communicans and the white ramus communicans, which go into the sympathetic trunk ganglion, which extends up and down throughout the entire spinal cord. I think that's about it.